Okay, so a very good evening to all the eminent doctors, and thank you so much for your presence and joining our today's webinar. Our endeavor is to spread the awareness about the rabies, which is a fatal but can be avoided once if we get properly and appropriately vaccinated. So this is an initiative by the Cadila Pharmaceuticals through its innovation to serve the society and the humankind. So the topic of the webinar is today's webinar is the dosage reduction strategy in the rabies management and the role of a novel vaccine. So, dear doctors, let me tell you about some of the the importance of rabies. So, rabies is one of the world's first novel vaccine with the anti-rabies vaccine, and with a great pride, we would like to inform you that Thrabis has successfully completed its 1 year of launch with more than 40,000 animal bite victims being vaccinated, and it is recorded with 100% patient compliance and with no case of adverse drug reactions was registered. So with this, it's my privilege and it's my honor to introduce today's webinar speaker, Dr. Sumit Podar, who has done his MBBS, MBA, and the PhD from Lincoln University, and currently he's a president of APCI, that is the Association for Prevention and Control of Rabies in India.
আমি এখন কথা বলবো কি করে?
Uh,
হ্যাঁ?
I would like to request you to please
হ্যালো
during the entire session.
স্টার্ট ভিডিও তো এখানে কাটা কেন?
I would like to request Atul, please mute yourself during the entire session. Thank you so much. So, as I told you that Dr. Sumit Podar has done his MBBS, MBA, and the PhD from the Lincoln University, and he's in the president of the APCRI, that is the Association for the Prevention of Control of Rabies in India. And now I would like to request Dr. Sumit Podar to initiate the talk, and later on we will have a quick question answer session to make this webinar a very, this interactive and very successful. Over to you, Doctor.
Thank you very much. Am I audible?
Yes, sir. Yes,
Am
sir.
I audible?
Yes, sir. Audible.
Okay. Thank you very much. One thing that is, after a long time, again we are meeting for the newer group of vaccines that came for the prophylactic use of the hydrophobia or rabies patient. So this is very important because it is the first. We started with 12 dose plus 2 booster dose of nerve tissue vaccine. Then we reduced the doses up to 10 doses of vaccine. Then it has come to 6 doses of vaccine. And finally, we are proceeding towards 4 dose to 3 dose. So novel vaccine that is really will be helpful in treating the animal bite cases. So it is very important. We all know that rabies is a 100% fatal disease. It never gives second chance to treat. So whatever we'll have to do, basically we'll have to give the proper vaccination and a proper knowledge about the wound washing and wound toilet. So these are very important things, and also usage of rabies immunoglobulin. But the main factor is within 3 days, this novel 3-dose G protein vaccine, ultimately which is the key for the compliance, that is being used. And in these cases, most of the patients are definitely getting the vaccines within day 7 will be protected by using these vaccines. Now globally is 59,000 human rabies deaths annually and highest in India. That is the main thing, because 59,000 human rabies deaths annually. But at the present moment, I don't think that it is 59,000 deaths. It is not that. actually it may come down to much lesser amount. So these persons are being victimized by the dog bite or the possibilities of developing of rabies, and that's why India is still authentically, that is on record, 20,000 human rabies death in a year from rabies, and accounting for 60% of the rabies death in Asia and 35% globally. So 91% deaths in India occurred in rural areas. Why this rural area? Because there is some less awareness program regarding the taking of vaccination on the wound toilet. That is an important place, essential. One is wound toilet. Second is in category 3, where there is a single, the patient needs rabies immunoglobulin. Within the 7 days, it has been developed a very good antibody titer or antibody response.
Is there a network glitch? Is there? I think we have lost the connection with the doctor because of the network glitch. Am I audible, Atanu?
Yes, audible, Siddharth.
Is there any network issue? Is there? Yeah, doctor.
Maybe. Just I try to connect him.
Sorry for the interruption. There was a network glitch.
Didi,
I can call
Didi,
Bijoy.
হ্যাঁ আমিও কল করলাম, ফোনটা বিজি আসছে। তুমি কথা বলেছো?
না, আমি কথা বললে কি আমি তাহলে বেরিয়ে চলে যাব কি ফোন থেকে?
হ্যাঁ, একটু বেরিয়ে বলে দাও না যে এটা কোনোভাবে ডিসকানেক্ট
আমাকে
হয়ে
আবার
গেছে আর একবার।
আমি কথা বলছি যে স্যার অলরেডি ডিসকানেক্ট হয়ে গেছে।
ঠিক আছে।
Yes, Atanu, what is the status? An update?
Yes. Hello.
Yes, Atanu, what is the status?
Just try to connect to 1 second of it.
এটা শোনা
হ্যাঁ স্যার, হ্যাঁ স্যার,
হ্যালো হ্যালো
হ্যাঁ স্যার, শোনা যাচ্ছে স্যার।
শোনা যাচ্ছে তো?
I'm
হ্যাঁ,
very
হ্যাঁ,
sorry,
স্যার, স্যার।
doctor. I'm very sorry, doctor. There was a network issue
করে
out
যাই,
there.
এই দুটো স্লাইড ব্যাক করে যাও না, দুটো স্লাইড ব্যাক করো আগে, দুটো স্লাইড ব্যাক করো।
হ্যাঁ হ্যাঁ স্যার, করছি।
This was the last slide that we are talking about.
শোনা যাচ্ছে? কেন am I audible?
Yes, sir. Yes,
Sir.
doctor.
ঠিক আছে, আমি কন্টিনিউ করছি।
Yes, sir.
Yes, doctor. You're audible, doctor.
Now, thank you, Shagurika. There is a lot, tomorrow network there is a huge problem. Anyway, today our matter of discussion is rabies, which is a public health challenge to our country, because globally, although there are 59,000 cases of human deaths annually, highest in India, but there is definitely at present moment India had a 20,000 human deaths in a year from rabies. Global picture is 59,000 deaths. We have gone into calculation in the year of 2003 and 4. Still there is 20,000. So the 91%, why this is in the rural area? Because there are maximum patients they're coming from the rural areas, and also knowledge, the initial management, that is the main cause. Nobody is bothering for the wound toilet. Nobody is bothering for the rabies immunoglobulin administration. No one is bothering for the vaccination. Moreover, the most important part is they are missing actually the doses of the vaccines. So we need, after this long study and long our observation, that we need such a vaccine. These vaccines should be very precise one, and it should be given very within a. It will release the antigen very slowly and will persist for the many longer period. So this vaccine is needed because we'll have to give only day 0, day 3, and day 7. This is the total dose of the vaccine. WHO is also trying to minimize the dose. So it is a very important thing that we'll have to treat the patient properly. We'll have to minimize the death in India and definitely also in the globally. So we'll have to give such a vaccine which will protect the patient from the development of rabies. So 91% of deaths in India occur in the rural areas because there are very less knowledge. The other persons who are staying in the city and these areas, they are well accustomed to have the treatment properly. So this is the main thing. Next slide. Next slide, please. Next slide.
Yes, sir.
So current management is very important. That already I have mentioned local wound toilet for the first aid, one thing. Active immunization is with the vaccine and also the passive immunization with rabies immunoglobulin administration. What is rabies immunoglobulin? That is the ready-made antibody. That means it will neutralize the virus at the site of the entry. So these three important part is very much needed and essential for the management of rabies and prevention of rabies. So first of all, local wound toilet, 15 minutes at least under running tap water. That is the standard guideline. So we not have to use the soap and water because soap definitely it washes the initial the deposit of the virus at least in the locally. In the locally, it should be used properly and for 15 minutes under running tap water. Then active immunization of the vaccine, that is much more important, and passive immunization. Active immunization means at least this vaccine is a special advantage that it is having only 3 dose schedule. So the patient, there is a dropout is not possible in these cases. So active immunization with the vaccine, which will definitely neutralize the virus in the entire system. And passive immunization, locally rabies immunoglobulin, which is one of the important aspect in treating the animal bite management. In case of animal bite management, it is very essential. Passive immunization with rabies immunoglobulin infiltration, it is very much important. So it will neutralize the virus at the site of entry. So this thing has to be kept in our mind that it should be given proper interest. So this is the we have seen already. There is a picture. Definitely, that is day 0, day 3, day 7, and day 14 is that actually on this day the patient gets his full antibody. Actually, they will get the antibody response that is more than 0.5 IU per ml of blood. That is a protected value, and also we'll have to give the day 28 dose. So we'll have to share the 5 doses of vaccine. Initially, I have already mentioned that we have started with this schedule regarding since long. This is known as the Asian schedule. Before that, when we have started that we are using the NAF tissue vaccine in the government sector, in the hospital sector, that we had to use it 12 to 14 doses of NAF tissue vaccine had to be administered in the anterior abdominal wall. But after coming this tissue culture vaccine or cell culture vaccine, so it is very much needed to take the vaccine and the 5 dose, and then it was reduced to 4 dose. 4 dose, that means intradermal, that is the 0, 3, 7, and day 28. That is the dose schedule in intradermal regime. And now we are thinking that the dose can be reduced if the vaccine quality is much better and it will neutralize the virus as a whole without the patient disturbing the patient in other aspect. He will come and take the vaccine and will go. So this is the main thing, that we can use the 5 dose versus 3 dose versus this is the comparison between the 5 dose and 3 dose, and so it can be given. And 4 dose is only possible in intradermal regime. Now, regarding the intradermal administration of vaccine, one thing is very important, because the persons well administering the intradermal vaccination, he must be very skilled that it should be proper intradermal. Otherwise, it will not act. So it is also very difficult thing. So we need such a thing that the vaccine cannot causes the failure. we have discussed previously in several, A are there, failures are vaccine-related failures are there, and there are many factors are responsible for the failures. So we will have to decide, stick to the one thing, wound management with soap and water and running tap water, number one. And second is your, if it is three categories are there, category 1, category 2, and category 3. Category 1 and category 2 does not require any anti or rabies immunoglobulin administrations. Just a minute. Okay, this is the only thing, category 2. And category 3 is, that is another important thing. We'll have to deal with the categories. Most of the cases, about 90% of the patients, they suffer from the category 3 exposure. So this patient needs additional treatment with rabies immunoglobulin, and rabies immunoglobulin should be given on by day 7. So it is very important that the vaccine to be administered by this way, and by day 7, the rabies immunoglobulin to be that one. So it is a time to think about a novel vaccine, that is the 3-dose schedule with the current VLP technology, that is virus-like protein, that is the system only, the broad preparation of the vaccines in different states. And so this can resist the patient not being infected with the rabies encephalitis. So these are very important things. So these are the separate several A of the vaccination schedule. Next is, next letter. Kindly change the slide. Kindly change the slide. Yes. That is the current challenge of the post-exposure prophylaxis. So there are many challenges are there. One is non-compliance is one thing. Current rabies vaccine are cell culture vaccines that everybody knows. And inactivated vaccines are more than 50 years old technology. So in every year, the technology is definitely, it is changing. So it is proceeding towards a very good high technical aspect to be seen. And inactivated vaccines are really, it is more than 50 years old technology. So inconsistency, in potency. So if the potency is less, so if the potency is definitely less, the patient will not get the proper vaccination schedule. The proper antibody will not be produced. So potency is very important. That means the storage. That means whenever we will give the vaccine, that should be kept in a proper position. It should not be exposed to sun rays and sunlight. And stability is there. Availability of, that is another important thing. If we suppose we have started a 5-day schedule, that is essential schedule, that is RTRC schedule, that is the thyroid cross schedule, that is the intradermal schedule, there may be a short supply. And so you can use this one, but after getting the 2 or 3 doses, you are not getting the full dose, so that completion of is not possible. So that is very important thing. And there are definitely some adverse events are there. So that is also adverse events are they are present in different vaccine schedules, and that should be discussed in separate day. So this is an important thing. Kindly change the slide. Stability, availability, I mentioned now. Compliance of anti-rabies vaccine is one thing, is who received full course of anti-rabies vaccine, that is the scheduled doses of ARV on the recommended dates, number one. Second, delayed compliant is who received completed a scheduled dose of ARV within 60 days, but deactivated from the scheduled regime. So who has taken at least one dose of ARV after the animal bite but not complied all the scheduled doses. So anti-rabies vaccine, this compliance is very much essential to know that the patient after administering, after any dog bite or cat bite or any warm-blooded animal exposure, should receive a proper schedule of anti-rabies vaccine on the recommended doses. No dose has to be skipped. So this 3-dose vaccine definitely gives us enough scope to complete the course of vaccination in a shorter period. So who completed delayed completed there, who completed the scheduled dose of ARV within 60 days. Actually, this slide is misleading sometimes because the patient, whoever receiving the dose of anti-rabies vaccine within 60 days, it is not the The next is WHO protocol is who the next bite in case of any, suppose the patient receive full course of vaccination. After that, the next day again there is the re-exposure is there. Then again he'll have to take the 2 doses of anti-rabies vaccine. So it should be considered in this way. So any exposure, whether it is old or new, in the exposed patients who has taken the vaccination, he must take the 2 doses of anti-rabies vaccine. Number is non-compliant who has taken at least 1 dose of ARV after animal bite but not completed all the scheduled doses. So basically, we will have to think that we will have to give vaccinations properly so that we can complete the course, and a patient should get the full course of anti-rabies vaccination after any animal bite exposure. But if it's not completed previously, it should be again taken as treated to be as a fresh course. So next slide. Next, please. Next, please.
Yes, sir. Yes, sir.
So rabies post-exposure prophylaxis in routine practice in view of the new Centers of the Disease Control and Prevention of World Health Organization recommendation. Number one is a retrospective analysis of a travel clinic. A total of 110 patients will receive the rabies 4-dose post-exposure prophylaxis. Some shortcoming in this management of these patients were late initiation of rabies PEP in travelers. So travelers is a separate thing. That is the patient in case of the patient in the travel period, he must get the full course of vaccine, full course of administration of human rabies immunoglobulin and antibody level so that more than 0.5 U per ml of blood. And so it is very important. So next is next slide. Next slide, please. So this is the non-compliance of 5-dose proven cause of death. This is actually I am telling that the Asian schedule, diagram schedule, and IDRV schedule. That is 3 courses of it. Now, the non-compliance of to 5-dose proven cause of death, the patient is depending on this. The cause of death depends on several things. One is primarily wound toilet to be done properly, number one. Second thing is our rabies immunoglobulin in case of category 3 or rabies immunoglobulin in immunocompromised patient, particularly the patients are suffering from HIV/AIDS, and also they are the patients on cancer chemotherapy, the patients with the immunocompromised diseases like cirrhosis of liver and all these things should get the proper dose of vaccine. So it should be the basic treatment is, again, I am just hammering the same message to everybody that wound toilet is must. Number one, it will at least remove the 50% to 60% of the virus Number second is the important thing is the our administration of rabies immunoglobulin in case of category 3 cases, and in case of other day, that patient should get the full course of vaccination. Now, the advantage of this novel 3-dose vaccine is that you can complete the treatment within 3 doses of vaccine. So 3 doses of administration of vaccine can save the life of a patient. Number one, that is very important. Second thing, it must be in our mind that we must go for the wound toilet properly, and we must also see that patient is immunocompromised or not. And another is the rabies immunoglobulin has to be given. And so if the patient is suppose immunocompromised and has a category 2 exposure, but he should be given the treatment as guided by the WHO. That is the full course of anti-rabies vaccine as well as administration of rabies immunoglobulin and like this. So, and wound toilet, of course. So these are the main things in for the treatment of any our the animal bite or exposure to dog, cat, and any warm-blooded animal. Next, please. Next. Next slide, please. Next slide, please. So that is there are many patients have been reported from the Safdarjung Hospital, New Delhi. Dr. Jugal Kishore is there. He is continuing all the studies and everything there in Delhi. And 360 animal bite patients they have given the pre-designed, pre-tested, structured questionnaire was administered by the interview technique. So it is also important. Every doctor should know that also they should be kept in their mind. So it is very important. And next slide, please. Next slide. Next slide. Next slide. Next slide, please. So this is another. At municipal. This is not important so much. Whether the importance is the distance from the hospital or patient's A to clinic. That is, if the vaccine should be taken, number one, immunoglobulin should be given in case of category 3 exposure, and wound toilet to be done initially. That is, whatever distance is there, that matters nothing. The patient, because rabies will not give the second chance to treat. So we will have to give the vaccine properly. We'll have to give the patient is category 3 or immunocompromised patient should get the full course of rabies immunoglobulin as well as the vaccination. And regarding the why I am stressing this one, because this is a novel vaccine that is on the 3-dose schedule. The patient will get the antibody response very quickly, and within these 3 doses, the patient will get at least a very good day, within the day 14, he will get the very good antibody protective level of response that is more than 0.5 IU per ml of blood. So that is the essential, and that is the very much important issue. And one thing I am telling, we have seen in our life that we have prescribed the full course of vaccination that is on essential schedule regarding the 5 doses of vaccine, but the most of the patients we have seen that misses 1 or 2 doses. It is not important thing. So we'll have to proceed for a very tentative aspect regarding the vaccination schedule and all these things. The patient should get the vaccine properly, and within this one, the patient will be protected by on day 14 when the patient will be fully immunized, and definitely it will help in definitely treating the rabies infected patients. Rabies infected patient, not that in that way. What I want to tell, that rabies actually will not give the second chance to treat. So we'll have to give the vaccine properly so that we can give the vaccine in such a way that the patient will be definitely will develop a good antibody response. Next slide, please. Next slide is evolution of rabies vaccine. Already I have mentioned in the year of 1885, when we have seen the duck tissue vaccine was administered in a patient Joseph Mister by Louis Pasteur. That is the makes the history, and the patient survived. So after that, in 1911, David Semple was there definitely. Also, he has used the vaccine in 1911. So that is another important. And there is when the entire thing has changed when 1976, when the patient is getting the inactivated vaccine, cell culture vaccine, with a antibody response and titer of 2.5 IU per ml of blood. So it is a very important thing. One, this is very, very much important. This cell culture vaccine is being used. So, so these are very important things. And still, I am telling the treatment regime from 5 doses are still on. That is on the agent schedule, in the intramuscular schedule. But in the government sector, everybody is getting the patients, all the patients are getting the IDRV schedule, where it is very much observed that that is a very good schedule, and it is definitely beneficial to control rabies by 2030. That is the main thing, because all the patients will get the within this schedule 0.1 ml, 0.1 ml. So minimum wastage of vaccine. That is very important. And so it is being utilized in the government sector and also in some of the private sectors. That is also important. And the patients in the private sector, particularly who are not accustomed to giving the IDRV schedule, they should not be allowed to give the vaccine in intramuscular schedule. They must be given the vaccine in the intramuscular schedule. So this has to be taken care, because the chance to treat. Next, please. Next slide, please. Next slide, please. Next slide. Next, please. There is a main thing, novel 3 dose already being skip chole galo to eta already skipped. This is the normal BLP technology. There is a virus-like protein technology, but
What happened, Atanu? Was there again there's a glitch?
1 second, maybe disconnected.
Yeah, we have an audience of 100 plus in this session.
Didi,
Fan has already disconnected.
no, Digvijoy here. Digvijoy.
I can. Digvijoy da.
bolo.
Connect, sir. Connect to sir.
Sir.
Please tell
Sir.
me.
Yes, sir. Please continue, sir.
Sir, please continue, sir.
Please.
A very bad network, na?
Sir, moreover, we are happy to announce that we have 100+ audience who have joined in this session, sir.
Very nice, sir. Very nice.
One thing that is your important thing is this is a mechanism that a G protein vaccine, a G protein based vaccine is working on this prevention immunity. Just like that. So this is very important thing. So this is very important thing. So the nature virus is there, native virus is there. After the VLP, such as your important that these are the nanoparticles but can mimic the viral antigenicity without being pathogenic. That is
Tremendous network problem is going on.
particles, but that do not contain the viral genome. It is important. So they are capable of inducing a strong humoral and cellular immune response. Regarding the immune response, if you go through the immune response, you will see the humoral and cellular immune response is there. So, humoral and cellular response. Hello. 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 Hello.
Yes, sir.
Hello.
Audible.
Hello.
Audible. Yes, sir. Audible.
So this is a VLP technology. That is a virus-like particles developed, and that can be used in the prevention of rabies. Okay, that as a vaccine, it is very good, and it is inducing by maximum. It is full protected by 7 days. That is day 0, day 3, and day 7 dose of vaccine. It is very much effective. So there are studies. One is the 2 doses versus the 3 doses. So regarding the 3 doses, there are multiple clinical studies are there, and we have seen that this is highly protective for controlling our rabies infection. So this is another important thing that sero. So you can go through the analysis of the body.
Tremendous network problem.
Digvijay da?
Digvijay, please mute yourself. Digvijay.
Yes, yes. Yes, sir.
Is also celebrating their dates are there. So you can go through the analysis of the antibody. You will be able to different day 14 to day 42. You do the blood test for antibody production, and day 90, day 180, and day 270. So these are the important things.
My God.
এটাতে করো। Hello.
Yes, sir. Audible.
Audible now. Okay.
No,
So
sir.
Yes, sir.
infection data to be seen properly. Next is your next slide টা করো এটা। এগুলো তো কিছু আসছে না একদম দূর। হ্যালো 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 হ্যালো
Yes,
Hello,
sir,
sir.
you are audible.
Sir,
Yes, sir, you are audible.
শোনা যাচ্ছে এখন? ইজ ইট অডিবল? আই ক্যানট।
yes,
Yes,
sir.
sir.
Is it? It is possible. I will request
This
Digbojada.
this
I would
this
request Digbojada to.
study, this clinical study phase 3 already been published in the human vaccines. So we know the efficacy, and today really this need for the minimizing the dose of vaccine is very important. One thing, we must go through the basic treatment, that is the wound toilet. Second, in case of category 3 case, everybody should get the rabies immunoglobulin. And in case of our using the ready-made antibody, that we'll have to do, as well as we'll have to give the 3 doses of vaccine. What are the dates for the vaccination? Day 0, day 3, and day 7. So these patients, suppose once they will get the 3 doses of vaccine, by next, in case of re-exposure, you will get the 2 doses of vaccine. And you can do an antibody response on day 40. See the level of the protective level of antibody on day 14, and calculate accordingly and take the decision accordingly. So it is a short dose, and but is very protective, efficient dose, that is uses of 3 dose of anti-rabies vaccine. So let us proceed for the higher rate, because in case of our other vaccination, that is the other cell culture vaccine, we have to use the 5 dose to 4 dose at least. And another one, whether it is varicella or whether it is a chick embryo cell vaccine, we are using this one. So this is very important issue, an important thing. And another, I think it is better to go for the normal question answer. Mainly the normal question answer should, we must take the a challenge for the normal patients, how they will take the vaccine. That is much more important, how we will use it. Regarding the vaccination schedule and vaccination part, I think Sagurika and other are there. They will definitely will take part in the regarding the quality of vaccines and all these things. So that is very important thing, that kindly go through the certain questions where, that is where the patients need vaccine, and what is the dose of the vaccine, and what is the dose for the re-exposure, what is the dose for the immunocompromised patient vaccination. So these are the main issues. So we have seen these vaccines, we have a publication also in the vaccine journal as well as APCRA journal regarding this vaccination. So regarding this, regarding their vaccine, the protected vaccine. So it is very important. So I think Sagurika, you can ask for the different questions. So the time is already very nearby. It will finish soon actually. Come through the vaccine schedule. Okay. Regarding the study, conclusion is that novel pre-dose was is another one.
দিগ্বিজয়দা, তুমি আনমিউট করো তোমাকে। দিগ্বিজয়দা, unmute করো।
হ্যাঁ,
দিগ্বিজয়দা, তুমি আনমিউট করো তোমাকে, সেই জন্য সাউন্ড হাউলিং হয়ে যাচ্ছে।
golden goose Tigers award for the innovative product of the year. So wherever those there are minimum cases found in the malaria,
Sir, is there any question?
Hello, doctor.
inferior, and this is another one, the economic.
Hello, doctor.
Vijay, can you give your phone to Dr. Sumit Poddar and please mute the phone of Dr. Sumit Poddar because in your phone network is good. Yes, sir.
And novel 3 dose was non-inferior to reference vaccine. So it is first of all, this is very important. It is definitely novel 3 dose vaccines are non-inferior to other vaccines. So this is a number one, less adverse effects compared to the reference vaccines. This is actually we have infiltrating many patients were giving the vaccines properly in the intermuscular schedule, and that is very less adverse effect. That is, no allergic reaction was found in my at least in my case in my clinic, and also it is definitely well affected, tolerated by the all the patients. So it is also it should be compared with the reference vaccines other. So novel 3 dose was found to be safe and immunogenic, and was comparable to 5 dose of WHO pre-qualified vaccine. That is the most important thing. First of all, I was telling during the my starting in the lecture, that is, the patient should get the proper dose of vaccination. Now, previously we started with the 14 dose of vaccines, 12 plus 2. Then came down to at least 2 dose, 3 dose should be cut, should be skipped. Then afterwards, it has come to 6 dose of vaccine, to 5 dose of vaccine. After that, 5 dose already essential schedule is there, and 4 dose. After that, 4 dose, and this 3 dose has is the first time that we can give the 3 dose of vaccine. WHO is also given the in certain cases to use the 3 dose of vaccine. So it is very important to establish this one, that the patient can be protected and safe regarding the infiltration of the this kind of vaccine, which is really novel 3 dose, found to be very safe and immunogenic. So it is definitely the time has come. People has got the least time to take the vaccines even. But as because it is a deadly disease, we'll have to take the vaccine, give the vaccine. This is possible in every sphere where the patient is getting the vaccine. It is a category 2 or 3 that patient should get the proper dose of vaccination. And in addition, in category 3 cases, the patient should not be skipped from the immunoglobulin, rabies immunoglobulin administration. And of course, if the patient is immunocompromised, that is a take-off message. If the patient is immunocompromised, please administer the patient with the vaccine as well as with the rabies immunoglobulin. What the vaccine will do, it will definitely start working after the day 7, and definitely it will be very protective one. And what will do in case of day 14, it will be definitely protect the patient by developing by the rabies. Our this A will be this definitely this study should be continued for a more longer period, and ultimately establish that this on day 14 it has established to be a very protective level of development of protective level of antibody. That is the main thing. So this is the main thing that patient should be, but do not ignore one important point. That is, if the patient receives the full course of vaccine in previously any vaccine, the re-exposure dose should get the 2 dose of vaccine. That is a standard protocol. And also wound tolerate is a standard protocol. Rabies immunoglobulin administration in case of category 3 exposure is a standard protocol. The only difference is we are using the less days and this number of vaccines in producing the proper antibody level on by day 14. That is very important. So this is the thing. And another important thing, our less side effect is there, and novel 3 dose was found to be very useful, pre-qualified vaccine. So that is also very important. The 3 versus 4 versus 2, 3, that is 5 versus 4 versus our less number of vaccine, 3 dose of vaccine. So this is very important, and this what they have received from the my innovation of the year by the economic time. It is also really it's very good, and Golden Globe Tigers Award Malaysia for the innovative product at the year. So we need such a vaccine. That vaccine will release antigen. Antigen will be given to. We are waiting, and we are definitely. And very soon we will get also this. So this is any other question is there? Kindly. Hello.
Yes,
Yes,
doctor.
sir.
Hello.
Yes, doctor.
Yes, sir.
কিছু কোশ্চেন থাকলে kindly
Yes, sir.
if you have got some
Good evening,
question.
doctor. Good evening, doctor. Myself, Siddharth, and I'm from the marketing team of the Cadila Pharmaceuticals, directly from Ahmedabad.
Yes.
I have a few questions in my mind. Like if a person get bitten during the after taking the vaccination, so is it necessary to take the vaccine again? So is there any time period of this efficacy?
Yes, this is a very good question. Thank you. Irrespective of time and everything, the standard WHO protocol is whenever there will be exposure, the patient will, even it is a re-exposure, the patient will get 2 doses of vaccine. So this is the standard protocol that suppose a patient has received the full course of vaccination by 2 days or 3 days back. Again, he has been bitten by a rabid dog or any other dog. Then what you can do, we'll have to give the again 2 doses of vaccine. So that is very important. So rabies will never give a second chance to treat. That is the primary thing. And the importance of wound toilet is very important. 50 to 60% of the virus can be washed out by application of the proper wound toilet with soap and water under running tap water. But this is a very good vaccine because within 3 doses, and still now I have already using it since long, since its arrival in the market, and definitely I have seen that no failure or other cases has been reported up till now. So, and the antibody also I have done from the proper lab, and also there is no difference in the production of the antibody. It is all protective level.
One more question, sir. Many of the cases are found in the dog bite, like 95 to 97% of the cases, anti-rabies cases are found with the dog bite. Is there any another animal bite you have came across with apart from the dog bite?
Animal not. It is not like that. It is actually the all warm-blooded animal bites needs the treatment, and the treatment is all warm-blooded animal, whether it is
Uh, I would like to request Digvijay to hand over his device to doctor because you have a good connection.
Digvijay da,
I would like to
whether
request
the
Digvijay
disease or not, same treatment protocol by a rabid dog, the treatment and also the vaccination. Dog bite, history of dog bite, that is the paid dog.
Yes, doctor. Yes, doctor.
yes sir.
Am I audible?
Digvijay da,
Yes, sir. You.
Digvijay da, তোমার
Please
এটা
tell me any
ইয়ে
other
করে দাও,
question?
মিউট করে দাও।
আমার
Uh,
ফোন দিয়েছি দাদা, আমার ফোন দিয়ে মাঝে মাঝে করছে।
হ্যাঁ হ্যাঁ, তোমার
Hello?
ফোনটাই দাও আর তোমারটা মিউট
yes,
করো,
yes, doctor.
এই স্যারের
So
ফোনটা।
there was a network glitch out there, but I couldn't able to get the answer of that. Like, have you ever experienced gone out or experienced with the any other animal bites apart from the dog bites? Because there was a network glitch out there.
Hello?
Hello, doctor. Am I audible?
Yes, now audible.
I was saying during the answer there was a network glitch and I'm not able to get the answer. So is there any animal bite apart from the dog bite from which the rabies is occurred?
Apart from the animal bite, apart from the the treatment protocol is same. I am telling you. That is, so any warm-blooded animal, any diseased dog bite, any non-diseased dog bite, or any good dog bite that is with the good health, and the same protocol has to be followed. Because I am telling you, whenever we are telling that the watch the dog for 10 days, suppose we have watched that one, but on the 9th day, the dog has expired. So, and that is due to rabies. So, that time the initiation of the treatment is delayed. So, it is very a crucial one because we have a history of development of rabies encephalitis by 3 to 4 days of time. And we have also history of development of rabies after a very prolonged period. So it is definitely we'll have to go through a proper protocol that is being designed by the WHO. That should be followed by properly. Okay.
Okay, doctor.
The treatment protocol for immunocompromised patient, the patient on chemotherapy, the patient on other immunocompromised drug, on steroids, on anti-malarial drugs, has the same line of treatment. We'll have to give the vaccine, we'll have to initiate the wound toilet, and also we have to give the rabies immunoglobulin. And within this time, because this 3-dose vaccine has an immense role to play. Because by within a short period, he is getting the full antibody response and protects the life of the patient.
Okay. So one last question, doctor, from my side.
Yes.
One last question is that have you apart from this vaccination, this once a candidate is or a person is get bitten by any pet animal, even if the pet animal is vaccinated,
Same treatment. Pet dog bite, vaccinated pet dog bite, diseased dog bite, normal dog bite, same protocol has to be followed.
Okay.
Same treatment.
Siddharth,
No other
Siddharthji,
option for the different kind of treatment.
100% fatal, sir. As rabies is 100% fatal, that we have to follow the same result.
Right.
Yes.
Right. Very good.
Siddharthji.
Right.
Yes, Siddharth.
And what we need to create some awareness by placing the hoardings, by going to school levels education. It should be adapted there. The children are the common victims, so they should get the proper dose of vaccine, and they should know what is rabies. That is important because we have a dream. What is that dream? By 2030, we will have to control rabies from the India. And WHO already has given us the guideline. And by adapting these only 3 doses of vaccine will definitely play an important role because less number of vaccine is there. Everybody will take the vaccine properly. Not so much strain is there. So it is the main thing that patient should get the proper dose of vaccination, the concept for the wound toilet, wound management with washing the wound with soap and water for at least 15 minutes of time. So these are very important issues. And don't ignore to infiltrate the wound with our rabies immunoglobulin if it is category 3. So it is very important. And in case of category 2 and category other categories, the category 3, definitely the patient should get the proper dose of vaccination. And don't skip the time, don't miss the time. Because sooner you will get the treatment, sooner you will get be recovered. So you will definitely the antigen, the antibody will be produced. So it is better to take no chance for prevention in animal bite management.
And sir, it is very much important for school going children too.
Of course, it is a
Very
very
much
important for the school
for
going children.
school
So
going children.
we should plan accordingly. You know how we have eradicated the polio. That picture should come in our mind. That we have infiltrated already given the polio vaccine to all, and by this way already we have already came into conclusion that no polio cases are being here right now. Now, so this has to be also treated accordingly like polio. All the patients will get the vaccine. All the patients should have a good knowledge about the animal bite and about the consequences and all these things. So different classes to be taken and different schools to be involved, different clubs to be involved, community, all community to be properly involved because the treatment protocol is very simple. Number one, wound toilet. Number second is our vaccination. Number third, if it is category 3, that means any bleeding wound that has to be given by the rabies immunoglobulin. So these are very simple things. But these simple things, there should be some hoarding from the other sectors, responsible sectors. There should be hoarding. And the people, the students, they should be involved in preparing the awareness program. In our last conference in Calcutta, when we, not last year before that, we have organized one program that school children are demonstrating the
Yeah, yeah.
rabies and the
I
treatment
remember
of
this
the
program.
vaccination with vaccination. So that is important. They are the commonly affected, so that is important. And everybody that plays with the dog, he should be receive the pre-exposure prophylaxis as well as the dog also to be vaccinated one. But one thing to be kept in the mind that the treatment protocol in vaccinating dog, in vaccinated dog, and other is the same. Whether the dog is rabid or non-rabid will not go forward. We'll just see whether it is a dog bite or not. If it is dog bite, whether the dog is well, we do not know whether the dog will develop rabies on the 9th or even on the 10th day morning. So we must be very cautious regarding the management, wound toilet, vaccination, and also rabies immunoglobulin administration. That will definitely one day will come by 2030. Our dream will come into reality. That is, the India will definitely will be on top in controlling rabies throughout the Asian countries and also in the globally. So that day we are waiting. And in this way, that the Cadila Pharma has already come with this wonderful vaccine, minimum dose of vaccination. So it will play an immense role. The role which will definitely, will definitely give a very good, a what I will say that it's really done very very nicely by this way.
Thank you so much at the time.
Thank you. Thank you.
Thank you so much, Dr. Sumit Podar, for the very informative talk. And it was a great session and it was a great learning from you. And we truly appreciate your efforts. And last but not the least, we would like to inform you that Travis has won the 2 prestigious award in its innovative category, that is Indian Pharma Award and the Golden Global Tiger Award. And it's a proud moment for all the Indians. And we need to take a pledge to make India a rabies free. And thank you so much,
Sure.
Doctor. Thank you.
And
Thank
sir,
you. Thank you.
on behalf
Thank you.
of Cadila Pharma, we are more than thankful to you, sir.
Uh-huh.
Thank you, sir.
Thank you. Thank you. Thank you.
Thank you so much, Doctor.
Thank you, sir.
Thank you very much. Sagarika.
Yes, sir.
Thank you.
Bye.
Thank you. Bye. Bye. কারেন্টে গেল। সালাউদ্দিন
লোক ছিল জানেন স্যার, নেটওয়ার্কের কি দোষ, 200 লোক ছিল নাকি আজকে, 200 নাকি লোক ছিল।
Sir, can we end the meeting?
লাভ বলতে পারি, তাহলে কি লাভ?
Sir, can we leave the meeting now?